Okay, so we're rolling. This is Toro the Bull. Got Gumby Gene helping us out. Toro, what's going on with your left leg?
Pain, burning sensation.
So how did this all get started? And you're okay if we video you, right?
Right.
Yeah, how did this get started?
It felt a tinge of pain on Monday afternoon. By Tuesday morning, it was swollen and inflamed.
And you said it drained spontaneously once or twice even?
Twice.
Have you had any fevers or chills with this?
No.
Okay, so this looks like you had a little spider bite or something there. Actually, Gummy Gene, let me get this back to you. If you'll give me the alcohol swab, I'll tell you what we're going to do for you here, okay? It looks like it was a little spider bite to me. I'm going to inject just a small amount of an anesthetic here, okay? And you're going to feel a little bee sting when we do it. But what's going to happen is that will allow me to then put a little larger needle in there and see if there's any pus, okay? Because I'm concerned that you may have a bit of pus. Gummy Gene's going to spray a little cold spray. He's going to feel a what?
Stick sting and a burn.
There you are, bud. A little stick sting and a burn. Yeah, I know it hurts. Looks pretty good, though. That's good. That's what we want. You want to take that? Thank you, man. Okay, so now we'll go ahead and swab this a little bit, and it shouldn't hurt as much. This may already be on the way to mending, okay? The fact that it's drained a couple of times is very encouraging, but the fact that it's hurting you enough for you to still come in has me concerned. But what I can see, and Gumby Gene, can you hand me that pen right over there? This may not be immediately evident on the video, but he's actually got redness that comes out all the way to here. Do you see that?
Yeah.
Can you see how the color changes there? Let me get you to turn just a little bit more. So it comes around just like that. See that? So I'm going to ask you not to wash this ink off tonight, okay? You can take a shower and all that. Just don't wash that ink off so I can, when we see you back tomorrow, we want to make sure that the redness is receding, okay, from there. So now we're going to go ahead and just put a little needle in here. Actually, this is a large needle. It's an 18 gauge. Okay, a little sting, not bad though, huh? Okay, good. So what we're trying to do here is just create an opportunity for this to drain spontaneously. Get that back to you. So that's a little bloody kind of pus come out. It's not bad. See, there's a little pus coming out of there, Gumby Jane. See that? Have we got anything we can do a culture with? All right, we have our culture swab. I thought we had one in the room, and we didn't. Okay, so we're going to just push on this again and get down in there a little bit, bud. Hopefully you won't feel a lot of pain. Ideally, we'd like to get way down in there. That's going to have to do. So these are almost always staph, okay? Every now and then we get surprised, but the antibiotics we're going to give you today, we're going to empirically treat you for staph, spider bite staph infection. And sometimes if these get worse instead of better, the fact that we've taken a culture kind of helps direct our antibiotic therapy down the line. Now here's what's important. We're going to put a dry dressing on this. We absolutely do not want you to put any kind of ointment on this at all. Okay, Mr. Toro? The reason is, if you put antibiotic ointment on there, it'll plug it up and it'll stop draining, and we need it to continue to drain, okay? So Gumby Gene, thank you so much for your help. She's going to send that culture in, and we want you back tomorrow for a follow-up. Any questions?
No, sir.
Good deal, bud. We'll see you then.
All right.
How you doing, bud?
Great.
So tell me, I just squeezed on this a little bit, so it's a little bit red right around the little scab there, but you can see from back here, the redness has receded quite a bit in from the markings that we made. Any fevers or chills overnight?
None.
Good, okay. And you said you're having a little bit less pain today?
A lot less pain.
Did it drain much yesterday?
A little bit of blood, not
Just
much.
a little bit of blood? Okay, not much pus. Okay, good. All right, so the only thing we want to do now is we want to stay on the antibiotics. Just I want you to put like a warm compress on this a couple of times a day. It'd be good if that wound would stay open, okay? Kind of heal from the inside out. And when we get the culture results back in, we may need to call you up and change something, but it looks like you're getting a good response to the antibiotics, so that's pretty doubtful that that's going to happen. All right, bud, thanks for helping us do a follow-up and letting us video for our friends on YouTube.
Yes, sir.
All right.
So, I've been taking Dr. Gilmore's Meta 7 along with a Women's Ultra Mega Greens multivitamin and started that about 4 months ago, and now I can remember things. I've dropped 10 pounds at least. My husband is now taking it. Our memory is better. We're both losing weight. literally body's reshaping itself, and our family's now taking it, and we love it. He's not feeling fatigue. I'm not feeling fatigue, especially with all the medicines I take.
You do look more alert.
Right? I'm awake.
Yeah, that's fantastic.
I play with my daughter now. I'm not ready to go to bed at 4 o'clock in the afternoon. So
no brain fog in the afternoon, right?
right,
Yeah.
absolutely. Less caffeine too, believe it or not. So
Awesome.
everybody take it. Can't say enough about it.
Thanks.
Hi, my name's Leanne, and I just want to do a review for Cocoa Skin Plus. I've been on it for about 2.5 months now. I do recommend it. It has given me, I don't know if you want to zoom in, my nails have definitely gotten stronger, and my hair. I did bleach my hair last year. Don't ever bleach your hair. It will kill your hair. And finally, my hair is actually looking normal. Thanks to this, actually. And it's a 90-day supply. It took about, I wasn't seeing anything really until a month and a half in to really notice changes. But it's been doing great. I love it.